Gluteal muscle strength becomes increasingly important after age 50 for maintaining mobility, preventing falls, and supporting lower back health. Today we're covering 5 evidence-based exercises specifically designed for adults over 50, step-ups, glute kickbacks, glute bridges, seated band abductions, and Bulgarian split squats. These exercises target gluteal muscles essential for walking, standing, balance, and spinal support. When practiced correctly and consistently with appropriate modifications, they can help improve strength, stability, and functional capacity. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have recent surgery, joint problems, balance disorders, or other health conditions. Understanding gluteal muscle importance after 50. The gluteal muscles consist of 3 main muscles: gluteus maximus, the largest muscle powering hip extension and standing, gluteus medius, crucial for hip stability and balance, and gluteus minimus, supporting hip abduction and stabilization. After 50, these muscles often weaken due to prolonged sitting, reduced physical activity, age-related muscle loss, and decreased challenging movement. Weak gluteal muscles contribute to lower back pain through poor spinal support, balance problems and increased fall risk, altered walking patterns, knee pain from poor alignment, and difficulty with daily activities requiring hip strength. However, research shows that appropriate strengthening exercises can significantly improve gluteal strength at any age, supporting better mobility, reduced pain, and enhanced independence. Exercise 1, Step UPS for functional leg strength. The first exercise is step-ups, building gluteus maximus, quadriceps, and training single leg strength pattern. Step-ups mimic real-world activities like stair climbing and curb negotiation while building unilateral leg strength essential for balance. Here's how to perform step-ups safely. Find sturdy platform or step 6 to 12 inches high. Stand facing step with feet hip-width apart. Place entire right foot on step surface. Press through right heel to lift body onto step using right leg strength. Bring left foot up to meet right foot on platform. Stand tall briefly. Step down with left foot first, then right foot, returning to starting position. That completes 1 repetition. Perform 8 to 12 repetitions leading with right leg. Switch and perform 8 to 12 repetitions leading with left leg. Start with 1 to 2 sets per leg. Rest 60 to 90 seconds between sets. Progress to 2 to 3 sets as strength improves. Important form reminders: press through heel of stepping leg, not toes. Keep torso upright, avoid excessive forward lean. Use nearby support for balance if needed. Move with control, don't use momentum from back leg. Ensure entire foot is on step before weight transfer. Modifications: for limited strength, use lower step 4 to 6 inches. Hold railing or counter continuously for balance support. For progression, use slightly higher step or reduce hand support gradually. What to realistically expect: with regular practice 3 times per week over 8 to 12 weeks, you may notice stronger single leg strength for stairs, improved balance during weight transfer, enhanced functional leg power, and greater confidence during stair climbing and curb negotiation. Step-ups build essential unilateral strength for daily activities. Exercise 2, Glute kickbacks for hip extension. The second exercise is glute kickback, strengthening gluteus maximus and training hip extension pattern. This exercise targets primary hip extensors essential for walking, standing from seated, and maintaining upright posture. Here's how to perform glute kickback safely. Stand tall behind sturdy chair or counter. Hold support lightly with both hands for balance. Stand on left leg with slight knee bend. Keep right leg relatively straight. Slowly extend right leg backward 6 to 12 inches. Keep torso upright and spine neutral, avoid arching lower back. Movement comes from hip extension, not back arch. Pause at extended position, squeeze right glute for 1 to 2 seconds. Slowly return right leg to starting position with control. That completes 1 repetition. Perform 10 to 12 repetitions with right leg. Switch and perform 10 to 12 repetitions with left leg. Start with 1 to 2 sets per leg. Rest between sets. Progress to 2 to 3 sets as strength improves. Critical technique points: maintain neutral spine throughout, never arch lower back. Keep torso stable and upright. Focus on squeezing glute at extended position. Move slowly and controlled, no swinging. Hold support continuously for balance. Modifications: reduce range of motion if you feel lower back involvement. Focus on proper glute engagement over movement size. For progression, add ankle weight 1 to 2 pounds if cleared by healthcare provider. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved hip extension strength, better glute activation during walking, reduced lower back compensation, and enhanced posture during standing activities. Glute kickbacks retrain proper hip extension pattern, reducing lower back stress. Exercise 3, glute bridges for posterior chain strength. The third exercise is glute bridges, which we've covered previously but remains essential for comprehensive glute training. Glute bridges strengthen gluteus maximus, hamstrings, and lower back stabilizers in safe supported position. Proper form: lie on back with knees bent, feet flat, hip width apart. Press through heels, lift hips, creating straight line from knees through hips to shoulders. Hold 2 to 3 seconds, squeezing glutes, avoid overarching lower back. Lower with control. Start with 12 to 15 repetitions, 2 to 3 sets. Optional: place small pillow between knees and squeeze during bridge to enhance inner thigh engagement and proper alignment. This foundational exercise builds posterior chain strength with minimal joint stress, essential for standing, walking, and spinal support. Exercise 4, seated band abductions for hip stability. The fourth exercise is seated band abduction, strengthening gluteus medius and minimus muscles. These hip abductors stabilize pelvis during walking, prevent lateral instability, and support proper knee alignment. Here's how to perform seated band abduction safely. Sit on sturdy chair with feet flat on floor. Loop light resistance band around legs just above knees. Start with knees hip width apart. Keep feet flat and torso upright. Press knees outward against band resistance. Move slowly and controlled. Hold at widest point for 1 to 2 seconds. Slowly return knees to starting position, maintaining control against band. That completes 1 repetition. Perform 12 to 15 repetitions. Complete 2 to 3 sets. Rest 45 to 60 seconds between sets. Important form reminders: maintain upright seated posture throughout. Move slowly, emphasizing control over speed. Press knees outward evenly, maintain symmetry. Keep feet flat on floor throughout. Breathe naturally during movement. Modifications: use lighter resistance band or reduce range if needed. For limited hip mobility, press knees only partially outward. For progression, use thicker band providing more resistance. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved hip stability during walking, better pelvic control during single-leg activities, reduced hip and knee pain for some, and enhanced balance during daily movements. Hip abductor strength is crucial for fall prevention and walking stability. Exercise 5, Bulgarian split squats for advanced unilateral strength. The fifth exercise is Bulgarian split squats, building advanced single-leg strength, balance, and hip flexibility. This challenging exercise provides comprehensive lower body strengthening when appropriate for individual capability. Here's how to perform Bulgarian split squats safely. Stand approximately 2 feet in front of low bench or chair. Place top of right foot on bench behind you. Hold nearby support with one or both hands for balance. Keep left foot flat on floor pointing forward. Slowly bend left knee, lowering body downward. Lower to comfortable range, ideally until left thigh is approximately parallel to floor. Keep torso relatively upright, chest lifted. Ensure left knee tracks over toes, doesn't collapse inward. Press through left heel to return to starting position. That completes 1 repetition. Perform 6 to 10 repetitions with left leg. Switch legs and repeat 6 to 10 repetitions with right leg. Start with 1 to 2 sets per leg. Rest 90 seconds to 2 minutes between sets. Progress very gradually. Critical safety reminders: use continuous hand support for balance. Start with shallow range, progress gradually over weeks. Move slowly and controlled throughout. Stop if you feel joint pain or instability. This is advanced exercise appropriate only after mastering basic exercises. Modifications: hold support continuously with both hands. Reduce depth significantly, even shallow range provides benefits. Elevate front foot on small platform to reduce range if needed. For very limited capability, substitute with standard split squats without rear foot elevation. What to realistically expect: this exercise is appropriate for those with good baseline strength and balance. With regular practice 2 to 3 times per week over 12 weeks, you may notice significantly improved single-leg strength, enhanced balance and stability, improved hip flexibility, and greater functional capacity for challenging daily activities. Bulgarian split squats represent advanced progression appropriate after mastering foundational exercises. Creating progressive gluteal strengthening routine: start conservatively and build gradually. Weeks 1 to 4, master step-ups, glute kickbacks, and glute bridges. Perform 2 to 3 times weekly. Focus on proper form and control. Weeks 5 to 8, add seated band abductions. Continue foundational exercises. May increase sets or repetitions gradually. Weeks 9 to 12, if appropriate for your capability, carefully introduce Bulgarian split squats with significant modifications and support. Continue all foundational exercises. Progression beyond 12 weeks, gradually increase repetitions, sets, or resistance for exercises where appropriate. Consider working with physical therapist for personalized progression. Not all individuals need to progress to most advanced exercises. Continue exercises appropriate for your individual capability, providing benefits. Essential safety considerations: these gluteal exercises support functional strength but require appropriate caution. Stop any exercise causing sharp pain, joint pain beyond mild muscle fatigue, dizziness or balance loss, or significant increased discomfort. Consult healthcare provider before beginning if you have recent hip, knee, or back surgery within past 6 months, severe arthritis with constant pain, significant balance disorders or frequent falls, osteoporosis with high fracture risk, or acute injuries. Always use sturdy support for balance as needed. Practice on non-slip surface. Keep exercise area clear of obstacles. Start conservatively and progress gradually based on individual response. These exercises work best combined with regular walking as tolerated, proper nutrition supporting muscle health, adequate rest and recovery, and other healthy lifestyle practices. Realistic expectations for strength development: gluteal strength improvements occur gradually with consistent practice. Weeks 1 to 4, learning proper form and technique, initial muscle soreness which is normal, beginning to establish routine, some may notice slightly improved capabilities. Weeks 4 to 8, exercises feeling more natural and controlled, noticeable improvements in gluteal strength, ability to progress repetitions or difficulty, improved ease during daily activities requiring hip strength. Months 3 to 6, clear improvements in functional strength for daily tasks, reduced lower back discomfort for some, better balance and walking mechanics, enhanced confidence in physical capabilities. The goal is gradual sustainable improvement supporting long-term mobility and independence, not rapid dramatic transformation. Importance of individualization: not all exercises are appropriate for all individuals. Bulgarian split squats represent advanced exercise suitable only for those with good baseline strength and balance. Many individuals will benefit more from consistent practice of foundational exercises like glute bridges, step-ups, and glute kickbacks rather than progressing to advanced variations. Work with physical therapist or qualified fitness professional for personalized assessment and exercise recommendations appropriate for your individual capabilities, limitations, and goals. Conclusion: these 5 exercises, step-ups, glute kickbacks, glute bridges, seated band abductions, and Bulgarian split squats, provide progressive gluteal strengthening from foundational to advanced levels. Start with appropriate exercises for your current capability. Practice 2 to 3 times per week consistently. Progress gradually based on how your body responds. Use proper support for safety always. Listen to your body and stay within comfortable ranges. Combined with regular walking, proper nutrition, and healthy lifestyle practices, appropriate gluteal strengthening can improve functional capacity, reduce lower back pain, enhance balance, and support continued independence and quality of life. Thank you for watching. For specific concerns about appropriate gluteal exercises for your situation, consult with a physical therapist or healthcare provider for personalized assessment and guidance. Subscribe for evidence-based information on strength training and functional fitness for older adults, practical guidance prioritizing safety while helping you maintain mobility and independence.